This episode is brought to you by Shopify. Forget the frustration of picking commerce platforms when you switch your business to Shopify, the global commerce platform that supercharges your selling wherever you sell. With Shopify, you'll harness the same intuitive features, trusted apps, and powerful analytics used by the world's leading brands. Sign up today for your $1 per month trial period at shopify.com/tech, all lowercase. That's shopify.com/tech.
Earlier this year, Lurie Children's, Chicago's largest children's hospital, fell victim to a cyber attack. The strike affected all internet-connected equipment, making it impossible to communicate by phone and email and access electronic health records. Lurie medical staff struggled to order basic tests like MRI scans or blood work and send prescriptions to nearby pharmacies. As a result, patients were left scrambling for care, with hundreds having to be transferred to other hospitals in the area. While the hospital immediately sprung into action to restore its systems, it took them over a month to get back to full operations. For patients, their families, and Lurie staff, this incident was a big wake-up call. So, how did it happen?
It's a ransomware attack. And ransomware attacks essentially cripple a network by infecting it with malware that essentially encrypts and locks the systems so the individuals can't access the data that's on them.
That's Rob T. Lee, Chief Curriculum Director and Head of Faculty at the SANS Institute, a company specializing in cybersecurity training and information security.
So when you're in a situation where a lot of hospitals, especially over the past 10 years, have transitioned many of their services onto online and telehealth, especially during COVID, that have increased productivity of the hospitals, but it's also left them very susceptible to these attacks because of the human factor. All it would take is someone either to call a help desk in some cases where someone could get a password reset and it would allow access to the network to be able to drop the malware, and the malware would then propagate through the network and encrypting and disabling as many systems throughout that network, essentially taking down the network.
Lee says the ransomware attack on Lurie's wasn't an isolated incident, but rather another case in a string of cyber attacks targeting healthcare across the U.S. While hackers have targeted other industries for years, it wasn't until recently that they turned their focus to healthcare.
For the longest time, cyber attacks left alone healthcare. In fact, there was an unspoken international norm of, critical infrastructure is off limits, and certainly life safety critical infrastructure. Think of it like the International Red Cross. Even during a war, there's a right of way given to International Red Cross to go on a battlefield and treat the wounded. So this used to be off limits for a long time. In February 2016, the first ransomware accidentally hit hospitals. It was called SamSam, and it disrupted, for example, Hollywood Presbyterian Hospital in LA. And they had to shut down patient care for a week, divert ambulances to nearest facilities, which in LA traffic is pretty bad, and eventually had to move critical care patients. It was pretty harrowing. And while it was not an intended target, ransom crews realized, wait, hospitals are going to pay. And very quickly, they went to the number one target of ransomware worldwide.
That's Joshua Corman, founder of I Am the Cavalry, a grassroots organization focused on the intersection of digital security, public safety, and human life. He says the life or death nature of these attacks have allowed hackers to extort hospitals for astronomical amounts of money. In 2018, the average payout was roughly $5,000. Now, hospitals are paying upwards of $2 million per incident. And in total, ransomware attacks on healthcare have cost the economy $77 billion since 2016. But while these hackers may seem like faceless, nameless individuals, we actually have a pretty good idea of who's behind these attacks.
The crews that are most prominent are criminal organizations out of Russia or Eastern Bloc countries. There's also significant activity out of North Korea, which is, while it is a nation state, it's mostly acting like a criminal to take the proceeds from these criminal endeavors to fund their nuclear program and national interests. And the most dominant by far is Russian crews who are either state tolerated by the Russian government or often state directed as well during certain campaigns.
Hello, I'm Anthony Anderson. When UNCF The United Negro College Fund was founded 80 years ago. They hoped they would change this nation for the better, and they have. As a proud alum of an HBCU, in fact, Howard University, I'm an advocate for HBCUs. I support the work that UNCF does for students of color, scholarships, and internships for 50,000 deserving students each year. Visit uncf.org today, and remember, a mind is a terrible thing to waste.
One of these Russian groups is Reseda, who was the perpetrator behind the Lurie attack. The group is only a year old, but has become one of the leading organizations hacking healthcare. And though they've extorted millions from hospitals across the country, Lurie wasn't one of them. The hospital refused to pay the $3.4 million ransom, restoring their systems without help from the hackers. In retaliation, the group claims to have sold patients' data on the dark web. While groups like Reseda say they don't steal data from those who pay up, Lee says there's evidence proving otherwise. And once your data is somewhere it shouldn't be, there's not much anyone can do about it.
If ransomware attacks and they do collect your data, there's very little that the victims can do at that point except trying to get back to normal. Hopefully, the ransomware attackers don't leak that information. And even though that they say we've taken none of the data, when the FBI and other law enforcement agencies have done takedowns of some of these remote networks, they have noticed patient data that's sitting on them. And they're trying to use this as a mechanism to remind all the hospitals and patients that are involved that even though they promised to not take any of the data, they've proven that they have in the past, and that may or may not be the truth.
And the Lurie incident isn't the only recent hack compromising patient information. In February, Change Healthcare, one of the world's largest health payment processing companies, was attacked. Despite paying a $22 million ransom, it's estimated that a third of Americans still had their health information leaked onto the dark web. Once that info is out there, cyber criminals can use it to commit prescription or insurance fraud, and in rare cases, even for blackmail. With a greater amount of private medical info getting into the hands of hackers, I'm sure you're wondering, what's the U.S. doing to fight this?
Europe, Australia, Japan, United States have really close law enforcement ties to where if there is a situation that's crossing international boundaries and country lines, the ability for law enforcement to work together successfully has never been better. However, a lot of these organized crime groups are not sitting in nations with easy extradition treaties. They're sitting in nations where they're fairly protected. Russia, Eastern European nations. If there's a warrant for your arrest, they're not going to be able to get that country to work with the international law enforcement agencies to be able to extract that individual. But what they end up doing is try to disrupt the networks, where in order to do that, you actually have to go a little bit on the offensive side, and you have to attack the networks and implant yourselves on the networks where these crimes are taking place. Whereas in the past, law enforcement was like, we just investigate.
Along with law enforcement, Congress is also taking steps to address this crisis. In May, a bipartisan bill called the Strengthening Cybersecurity in Healthcare Act was introduced in the Senate. If passed, the U.S. Department of Health and Human Services will be required to hold consistent evaluations of healthcare cybersecurity systems and report their findings to Congress. This will greatly improve what Corman calls cyber hygiene, which is in desperate need of an update.
We've made it easy for anyone, any accident or adversary to disrupt U.S. healthcare because we have very old, unsupported operating systems, very poor cyber hygiene. We got the benefits of connectivity, but we haven't paid the price for it yet. And now we're paying a different price for our historical neglect. And what we tend to see is really basic missing cybersecurity hygiene things that are present in other industries have not yet made it in healthcare. And we have empathy for that. It's a really cash-strapped industry. It's 20% of GDP, but it operates on razor-thin margins, if even viably. So we have a dilemma now where we both cannot afford to do any cybersecurity and cannot afford not to.
Hospitals and healthcare systems are improving their cyber hygiene by strengthening their firewalls, training staff on security measures, and expanding their cybersecurity teams. Patients can protect their information by turning on two-factor authentication for all healthcare-related accounts and logging out of accounts once they're done. Hopefully, these measures can shield hospitals and healthcare systems from more attacks before it's too late.
And the long-term harm is if you have 4 to 6 weeks cash flow on hand and a ransom can knock you down for 6 to 12 or more weeks, you may face permanent closure like over 200 hospitals have and counting in the last several years. St. Margaret's Hospital in Illinois was the first to claim their ransom was a contributing cause of their closure, whereas others have had similar effects. They're the first to say it out loud. And as these closures continue to happen as a result of these protracted attacks, we're starting to see massive parts of the continental US with care deserts with no intention of replacing them in a for-profit industry.
Both Corman and Lee agree that ransomware is a huge threat to health and public safety. In fact, there are already documented cases of patients dying due to complications caused by cyber attacks. And while many are rightfully worried about their own data, it's important we recognize that for some, these attacks are a matter of life or death.
Ransomware it feels like it's a simple attack, but it is probably the number one threat that I think most organizations and people probably feel on a daily basis. The amount of money that is being extorted out of these attacks is in the billions of dollars. This is a serious threat.
To find out more about Rob T. Lee, Joshua Corman, and all our featured guests, visit viewpointsradio.org. For more behind the scenes and to support our show, follow Viewpoints Radio on Instagram, X, and Facebook. This segment was written and produced by Grace Galanti. Our executive producer is Amira Zaveri. Our studio manager is Jason Dickey. I'm Marty Peterson.